Hi everybody, so today we're going to be talking about the stages of non-small cell lung carcinoma. This is just going to be a general overview. This can get pretty in-depth and I'm not going to go as in-depth as a doctor would, an oncologist would. So let's get started. And basically the first stage is what we call the occult stage. Okay, so in the occult stage, cancer cells are going to be found. Cancer cells are found. But you don't see a tumor. Okay, so you go for a test, and what's going to happen is they're going to say, okay, you're starting to get cancer. We just don't know basically where it is yet. So your doctor knows, the doctor knows you have cancer. They just don't know what part of the lung it's in. So normally what they'll do is they'll just keep an eye on this and they'll look and wait for the cancer to pop up so that way they can start treating it. So that's going to be the occult stage. Okay. So then the next stage is what we're going to call stage 0. Okay, so this is going to be stage 0. Okay, so in this stage, a few layers of cancer cells can be found. Under the lung tissue. And in this, it's only in one area of the lung. So a few layers of cancer cells can be found under lung tissues. I think I just said in a few, and it's in one area of the lung. Now, the occult stage and stage 0 have about a 60 to 80% 5-year survival rate. So you can see it's important to catch cancers early, as you can see. So they have about a 60 to 80 5-year survival rate. Okay, so let's go now to the next one. And this one is going to be stage 1. So here we can confirm that cancer is in the lung. All right, so we know that they have cancer in the lung. However, the lymph nodes aren't involved yet. And this is important because a lot of times cancer will spread through the lymph nodes. So there's no lymph node involvement. Okay, the cancer cells here are going to be found under the top layers of lung tissue. And this also has about a 60 to 80% 5-year survival rate. Now, one thing you'll notice here is this says that cancer cells are found under the top layers of lung tissue. When we were looking at stage 0, we said that the cancer cells are found under the lung tissue. So if we were to look at this real quick, if I erase this. Okay, so let's just say this is my lung tissue here. All right, and this is my lung tissue. And I'm just going to put some cells in here, and we'll put some more cells in here. All right, and I'm going to put even another layer of cells in here. All right, so in stage 0, what we're saying is your cancer cells would be down in here. Right, they're under the tissue. In stage 1, they're going to be somewhere in here, but not on the top. So let's say this is our top layer, right? So now I'm going to have my cancer cells in here. So normally what's going to happen is my stage 0 is actually going to grow up into this way. It's not like they're two separate things. And once it gets to here, my stage 0 is going to go to stage 1. So now we're on stage 1. Okay, so now let's go to stage 2. Okay, so in stage 2, once again, the cancer is confirmed in the lungs. So we did that in stage 1. And the cancer may be found in nearby lung lymph nodes. Okay, but cancer is not found in distant organs. So this has not spread yet. Okay, it's not found in distant organs. And at this point, the tumor is about 3 to 5 centimeters. Okay, tumor. Trying to make it sound like Arnold Schwarzenegger there, tumor. All right, and at this point, you have about a 20 to 30% 5-year survival rate. So you can see my survival rate is starting to come down. Okay. So to give you an idea, 2.5 centimeters is 1 inch. All right. 5 centimeters means this thing would be about 2 inches in size. So it's going to be from just over an inch to about 2 inches in size right there. Survival rate's going down. Cancer is found in nearby lung lymph nodes. Okay, but not the distant organs. So now let's go on to stage 3. And again, this gets a lot more in depth than this, but for right now, this will do fine. So now we're going to talk about stage 3. Okay. So in this case now, we know that the cancer has spread to nearby lymph nodes. Okay. The cancer can be found, actually the cancer spread to the lymph, and it's found in lymph nodes, in the chest wall. Okay, that's basically the inside of the rib cage. Right, so now you can see it's starting to get around a little bit. It can be found in the diaphragm. The diaphragm is the muscle that's underneath the lungs that goes up and down as you breathe in and out. Okay, it can be found in the neck. That's lymph nodes. It can be found in lymph nodes in the neck. And may spread to the other lungs, lymph nodes in the other lungs. Okay, so you can see now we're starting to spread here. So this is not good. Okay, when it comes to tumors, the tumor may be found in spaces around the lung. And structures in the opposite lung. So you can see now we're basically we're getting into the opposite lung. Okay, and that's bad because now if you have it in both lungs, that's pretty bad. Okay, and then also at this point, you only have about a 10 to about a 23%, depending on where you read, these numbers will change a little bit, 5-year survival rate. The bad thing is in all these stages, I'm already at stage 3. The bad thing is most of the time, there's no symptoms at this point. Okay, so stage 3, the cancer has spread to nearby lymph nodes in the same lung. It's found in lymph nodes. It can be found in lymph nodes in the chest wall, the diaphragm, the neck. It may spread to lymph nodes in the opposite lung. The tumor can be found in spaces, because remember, we're just talking about the cancer cells here being in lymph nodes. When it's in lymph nodes, that means it's going to start going to other areas of the body. The tumor can also be found in spaces around the lung and structures in the structures in the opposite lung. So that's bad. We're starting to get the growth here, okay? And when we say spaces, again, if we look, here's my lung, and here's my chest wall. And if you remember, we said we had something called the pleural cavity, right? And so what's going to happen now is I'll actually start getting the tumor growing into this space in here. So a lot of times it'll put pressure onto the chest wall right there. And that's when people start to feel the pain. So, and again, usually as of right now, there's not too many symptoms. And then the last stage we're going to cover will be stage 4. Okay, oops, let me stay consistent here. Okay, stage 4. And in this case, the cancer cells and tumor can be found in both lungs and lymph nodes throughout the body. So it has spread. Okay. At this point, there's less than a 10-year, 5-year survival rate. I'm sorry, less than a 10% 5-year survival rate. Okay, and the bad thing is 40% of patients are diagnosed in stage 4. Okay, so you can see this isn't good, right? Less than a 10% 5-year survival rate. And in fact, most people die within 6 months to a year, with the vast majority dying within 6 months. Within 6 months to 1 year. And again, most of the people are going to die within that 6 months. So those are the stages of non-small cell lung cancers. Like we said, the best thing is to catch this early. The best thing is to not smoke. Usually lung cancer are caused by smoking. And most of the time the symptoms will show up in stage 4. So in fact, I knew an oncologist one time, and he actually said that by the time most patients come to him, it's too late, and he just tries to make them feel better until they pass away. So that's the stages of the lung cancer, non-small cell lung cancer. And I hope you enjoyed the video.